This is the video presentation to guide how to prepare your centre for UCARE audit. What is the UCARE? UCARE is Urticaria Centre of Reference and Excellence. The UCARE network is part of GA²LEN. The main aims of GA²LEN UCARES are to provide excellence in urticaria management, to increase the knowledge of urticaria by research and education, and promote the awareness of urticaria by advocacy activities. GA²LEN is a global allergy and asthma European network. It is now the most widespread international network in allergy and asthma research. How to apply to become a UCARE. If you want to become a UCARE member, we would like to give you some information about the application process. First of all, please fill out the application form and send it to the UCARE office. Upon receiving your application, we will look for auditors and coordinate an audit visit. UCARE is a peer-reviewed network. Every UCARE head and deputy head is a member of the UCARE audit group and should help with the auditing and re-auditing of UCARE centres. Up to 2 hours should be scheduled for the audit meeting, and all the documentation required, for example, patient files, data bank, standing operating procedures, should be accessible at the time of the audit. The centre should be ready to show to the auditors the rooms and setup of the centre, and the team of the centre should be present during the audit in addition to the head of the Urticaria Centre. This is the checklist of the audit report. There are 2 categories, A and B. Category A requirements are specific for UCARES, whereas Category B requirements can be assumed to be fulfilled by centres that are part of a certified GA²LEN centre. Category B requirements are audited as part of the GA² quality management activities. Consequently, Category B requirements do not need to be included in the audit of urticaria centres at GA² centres. Urticaria centres that are not located at GA² centres are audited for A and B categories. UCARE audit requirements consists of 32 sections divided into 5 parts. Infrastructure or setup consists of 15 items. Management consists of 9 items. Research consists of 5 items. Education consists of 1 item. And advocacy consists of 2 items. Infrastructure and setup consists of 15 items as shown. Number 1. Hospital requirement. The centre needs to show that it works with a hospital in order to manage inpatient and outpatient services for their urticaria patients. Hospital setting ensure that the centre can do a complex diagnostic workup and manage exacerbation of urticaria where patients need to be monitored overnight. If the centre is not at a hospital, then it needs to provide the name of the hospital and the contact person or team at the hospital that they are working with. Number 2. Outpatient clinic with separate clinic hours for urticaria patients headed by expert. A minimum of 4 hours per week of dedicated urticaria clinic time is needed. This requirement is checked for by question and answer. The number of urticaria clinic hours per week is documented in the audit report. If there is written documentation on the number of urticaria clinic hours, for example, from an organisational chart or from information on the website, then this is helpful and should be attached to the audit report. Secondly, the centre needs to be led by an experienced physician. Experienced here means that the head of a UCARE should have several years of training and experience in the treatment of urticaria patients. He or she must be a board-certified specialist, for example, dermatologist, allergologist, internal medicine specialist, or a pediatrician. And this position must be clearly designated as such within the structure of the department or the centre that the UCARE is part of. The lead physician and head of a UCARE needs a deputy, and the name of the lead physician and the name of the deputy should be documented in the audit report. A UCARE may have more than one deputy head. Number 3. Open to children and adult patients. This is one of the most common challenges to many centres who are thinking about becoming a UCARE. Of course, many centres do provide care for children and adults, but there are centres where only adult patients are seen, and there are other centres where only children are seen. These centres should know that they can apply with their respective partner centre to become a UCARE together. Centres who only see children or only see adults can also become UCAREs if they can provide proof that patients of all ages who come to them will receive referral to excellent care in urticaria. Number 4. Team of dedicated staff with specific urticaria training. Consists of at least 2 physicians and 1 nurse. Each staff member should be able to show for at least 1 urticaria training per year. Urticaria training could come from GA²LEN allergy schools on urticaria, from participation in national or international congresses, from regional and local urticaria events and activities, and others. Number 5. Multidisciplinary research. Centres need to be able to interact with other specialties for the management of comorbidities, treatment, and to perform extended diagnostics. Evidence of interaction with other specialists should be documented in an audit report. Number 6. Accessibility and visibility. The centre should provide information on how it can be found on the web and how it interacts with physicians in the region as well as patient organisations. The contact information for the Urticaria Centre needs to be visible on the website, with specific contact information for patients and when the Urticaria Clinic holds their patient consultations. If this information is not clearly provided on the website, then this is to be changed by the centre, and confirmation that the centre will do so should be documented. In addition, the centre should have an interaction with a local referral network and patient organisation. The auditor will check these by question and answer. For example, how are urticaria patients referred to you by general practitioners or specialists, and which ones? Or, how many referring doctors and doctors do you work with? Patient organisations may not exist in all countries and/or may not be active in all regions. If they are, then the name of the patient organisation the centre works with should be documented in the audit report. Number 7. Communication skills. This requirement is usually easy to check during the audit because the audit is likely to be held in English, and one can assume in most cases that the centre staff is able to communicate in the national language. If the audit was held in the national language rather than in English, then it is advisable to do at least part of the remaining audit in English to assure that the centre staff is able to communicate sufficiently in English. This is necessary for the interaction with other UCAREs and within the global UCARE network, as well as for the management of non-native speaker patients. Number 8. Quality management. In general, QM systems aim at defining and describing responsibilities, pathways, and procedures within the centre. They rely on a QM handbook that includes all the standard operating procedures or SOPs of the centre. It is important that centres know that they need to have SOPs for urticaria management. These could be SOPs for diagnostic procedures, for referral to other specialists, for inclusion of patients into clinical trials, for assessing disease activity impact and control or others. Centres need to show that they have a well-described procedures in place and that they have and work with these SOPs. Number 9. Structured documentation, recording and archiving of patient data. The centre needs to provide evidence, ideally by presenting their databank or their registry-related activities, which confirms that this documentation of patient data is a continued process and that more than 50 urticaria patients during the last year are documented in this databank. Ideally, data from all urticaria patients seen by the centre should be included in the databank or registry. Number 10. Critical incidence reporting and error management. Each centre should have a mistake book or some other form of documenting mistakes. Mistakes here means anything that goes wrong and should not go wrong again in the future. This may be, for example, a mix-up in the administration of a drug, a mistake made during patient scheduling, or a problem with a diagnostic test. Mistakes should be documented in the mistake book and the action taken should also be documented. Number 11. Assessment of patient satisfaction and unmet needs. The centre provides proof that more than or equal to 40 patients were asked about their satisfaction in the last 12 months. Number 12. In-team communication. The centre provides evidence of regular team meetings, at least once per month, on centre logistics, projects and concepts. In the audit report, the frequency, duration and format of team meetings should be documented. Number 13. Active recruitment of research funding and support for educational activities and advocacy on urticaria. The centre can provide documentation of efforts to recruit funding, grant applications, donation programme. The documentation in the audit report should include the name of the organisations that the centre approached for research funding and for the support of education and advocacy activities. Number 14. Support of the UCARE network. Letter of intent to serve as a GA²LEN UCARE auditor and to contribute to other UCARE network activities. Number 15. Never give up attitude. To have a never give up attitude means that no matter how frustrated patients or the team may be, centres will never give up to find solutions for patients. Management is divided into 9 items as shown. Number 1. Knowledge of and adherence to the EAACI, GA²LEN, EDF, WAO Urticaria guideline. The centre should show to the auditors that the guideline is available either electronically or on paper at the centre and accessible to all centre members. Centre members will be interviewed on the content of the guideline. Number 2. Knowledge and use of current nomenclature and classification of urticaria. This requirement is tested by interview. The staff should be able to answer questions like, what are the 2 types of chronic urticaria? Or, name 2 subtypes of physical urticaria. It is important that all UCAREs use the same nomenclature as provided by the international guidelines. Number 3. Knowledge and the use of guided history taking or anamnesis. The auditor or auditors will check by interview or by reviewing patient files that centres use a structured and systematic approach when taking patient histories. Centres are strongly encouraged to work with the CURE baseline checklist for patients' first visit and to work with the follow-up checklist for follow-up visits of patients. Number 4. Knowledge and use of differential diagnostic algorithm. Centre physicians need to be aware of the differential diagnoses of chronic urticaria and know how to not miss them. The guideline algorithm can help with this. Recommended diagnostic algorithm guidelines should be available at the centre and the centre staffs will be interviewed. Number 5. Standardised assessments and monitoring of disease activity, impact and control of disease. The use of instruments for assessing disease activity, impact and control allows for standardised measurements and monitoring of patients can help to optimise urticaria management. Standard instruments such as the UAS7, AAS, CU-Q2OL, AE-QOL, and UCT should be present and known at the centre. Use of at least one of these tools, preferably the UAS7 or the UCT, in at least 80% of chronic urticaria patients will be checked. Number 6. Identification of comorbidities and underlying causes. Centres need to show, by interview or patient file review, that they use extended diagnostic measures to investigate patients for underlying causes and comorbidities. Number 7. Provocation testing and threshold assessment are important in the diagnostic workup of chronic inducible urticaria. SOPs are needed, as is the use of appropriate instruments, protocols such as dermographometers, temp test, pulse-controlled ergometry. Number 8. Knowledge and use of therapeutic algorithm. Centre physicians need to know and use therapeutic guideline algorithms. The International Urticaria Guideline Recommended Treatment Algorithm should be implemented at UCARES. Number 9. Counselling. Advice on triggers of exacerbation such as stress and counselling on urticaria-induced stress and other psychological issues is an important part of urticaria management in patients with chronic urticaria. UCARES should provide counselling for patients who need this or facilitate counselling by referral patients to psychologists or other specialised healthcare providers. Research is divided into 5 items as shown. Number 1. Scientific orientation. Centre staffs need to be up to date with the literature on urticaria, especially on pathogenesis, for example by participation in journal club. Centre staffs need to attend annual meetings or participate in other educational events of international scientific societies. Number 2. Scientific activity. UCARE needs to also be an urticaria research centre. Research here includes scientific activities in the field of basic science, clinical research, translational research, epidemiological and public health research. Number 3. Scientific productivity. Centres need to show that its research activities result in publications and other scientific output, at least 0.5 peer-reviewed papers on urticaria per year per centre physician. Number 4. Clinical trials. Centres need to participate in clinical trials, pharma and/or investigator-initiated, diagnostic and/or therapeutic trials, at least 0.5 trials in urticaria per year per centre physician. Number 5. Participation in registry. All UCARES should enter patient data in a registry. This may be a local, regional, national or international registry. We encourage the UCARE centres to participate in CURE registry. Education. Contains only one item as shown. Educational activities. Centres need to contribute educational activities on urticaria to physicians such as other specialties, for example, dermatologists, allergists, or physicians. Non-specialists such as general practitioners and family physicians, medical students, residents, patients and the general public. At least one educational activity on urticaria per year for physicians and one per year for patients. Advocacy is divided into two items as shown. Number 1. Increase awareness of urticaria. Centres need to increase awareness and knowledge of urticaria, for example, by contributing to Urticaria Day, support of the Urticaria Network, at least one advocacy awareness activity on urticaria per year. Urticaria Day, October 1st, is an important and unique opportunity to raise awareness of urticaria and to be advocates for the disease. Number 2. Interaction with and support of patient organisation. Patient organisations are slowly forming in many countries, and UCAREs in countries where this is happening and where no patient organisation is in existence yet should help patients to get organised and to build patient organisations in their country. This requirement may not apply if there is no organisation of patients that is active in the region for the country of the centre. Process to receive outcome of an audit. The auditor will send his or her report to the UCARE office with a recommendation on how to proceed. The UCARE office will then send the report and the recommendation to the members of the International Steering Committee. The members of the International Steering Committee will provide the UCARE office with their votes, and the results of this process will be communicated to the applicant centre after that. There are two major outcomes of an audit as follows. The centre will be certified or will not be certified. The first outcome is that the centre will be certified if all requirements are fulfilled. There may be areas with the need for further improvement, or there may not be. The second outcome is that the centre will not be certified if not all requirements are fulfilled. Then, the centre needs to provide documentation that the requirements have been fulfilled or to have a re-audit in due time. Re-audit and recertification. Re-audits are preferred with in-person and possible with video conference. All UCAREs need to renew their certification if they wish to remain a UCARE. The first re-audit should be done 2 years after the primary certification. The second re-audit should be done 3 years after the recertification. The third and all subsequent re-audits should be done 4 years after the last certification. UCAREs who want to be recertified should be in touch with the UCARE office in a timely fashion to coordinate the re-audit. For more information, please visit GA²LEN Activities, CURE, the International Urticaria Guideline Consensus Meeting, the Urticaria Network, EV, and Urticaria Day.